Good afternoon, everyone. Thanks for joining us again. Sorry to keep you waiting, it has been 1 year since we began our response to this pandemic. In fact, on March the 9th, Ulster County reported its first COVID-19 case. You may recall that was an Ulster resident who actually was participating in a training program here in Dutchess County, and I still remember the call on Sunday morning from Ulster County Executive Pat Ryan that began for us, although the world over had already seen its lives turned upside down. But for us began what has now been 12 months of upheaval, 12 months of change, 12 months of tragedy, and real challenge for all of us. On March the 12th, of course, Dutchess County confirmed its first case. And then on March the 13th, we declared a state of emergency. And then in conjunction with Orange and Ulster County, we issued orders to close schools and to restrict certain activities. And then on March the 18th, Dutchess County and we began our first town hall meeting. Today is our 60th. For 60 separate occasions, we've gotten together to talk through the data, understand the facts, and share what we knew, answer what questions we could, and provide you some guidance. And I hope these last 12 months, to some degree, a little bit of calm, a little bit of comfort, and I think you have seen as a community for these last 12 months, we have risen to the occasion. Over these 12 months, we worked through Dutchess Response to assist countless individuals. We opened our hotline and began the process of managing responses and bringing food and meals to residents all across Dutchess County who needed it. I can tell you that over the course of these last 12 months, we have seen so very much, and of course, in many ways, together, we've responded to it. I know that there are those who wish this had come to an end sooner. I know that many of our friends and neighbors want it over now, but let's just remember that since March of last year, there have been thousands upon thousands of people impacted by this virus. Hundreds have lost their lives here in Dutchess County, hundreds of thousands across the country. And there are families who were separated from loved ones in nursing homes, in residences for those with developmental and intellectual disabilities. Many haven't returned to their place of work or their office. Some, like those who work in the health department here and throughout governments like ours, haven't left their offices. I know that, like my wife, many families have had to come up with ways to keep their children active and involved, have had to manage work, loss of daycare, and remote learning. And certainly there has been extremely difficult challenges for small business owners who poured their heart and souls into their businesses only to have those dreams dashed. Many digging deep into their pockets to keep people employed, even if they didn't have customers, keep their lights on, even when they were forced to be closed. And some have been shuttered forever. There are families that have suffered immeasurable loss with loved ones that will never return, many of whom never got those last few minutes or moments together when their family member passed. I know I understand the real human toll of this virus, but I don't think any of us can really appreciate the challenge that any other has had to face, and we've all had to navigate this together. So as we acknowledge 12 months of being right here with you, responding to community needs, I also want to say that I am still very optimistic. I believe that now that vaccines are more accessible, and we'll talk a little bit about that today, as more and more have access to a vaccine, as more and more individuals have recovered from the virus, and as we've learned more about COVID-19, that very soon it's going to be in our rearview mirror, and very soon we're going to be back up on our feet in a more normal, or at least a more traditional and recognizable way. As we look forward, I do think that we ought to be optimistic about the opportunities that lie ahead of us. We have a lot of work to do, and we're committed to doing it. We'll talk a little bit about that. In fact, on Tuesday next week, I'll be releasing our State of the County address. But I do want to say this from the bottom of my heart. I know that when it comes to elected officials, it is easy to complain about them. I know that we always disagree. I know that I will have always made some misstep. But what I can tell you genuinely is I am grateful to the people of Dutchess County. I am thankful for those who have had the patience and perseverance. I am grateful for those who have agitated and irritated us to do things differently. I am grateful to the people who ask the easy questions and the pointed questions. I am grateful to the people who went off to work every single day, not skipping a beat, both in government and in the private sector, to help us in our moment of need. I am grateful to men and women who have had to suffer greater losses than I have. I'm grateful that somehow each and every one of you have summoned the courage, the compassion, and the strength to carry on. And I am grateful that as a community, I think in many ways we have set an example as to at least how to treat one another. There have been moments, where I know that we could have rattled apart, and I know that we have argued and had significant disagreements. But we've all experienced them in some ways together, either virtually or in person, either on television or on through the internet. We have experienced these last 12 months together, and I think as a community have risen to the occasion. We have a lot to still do. I want to get through a lot of information today, but I mostly, on behalf of the government of Dutchess County, on behalf of the people who work in Dutchess County, extend to all of our residents our appreciation for, even in moments where it didn't seem you had it, you did. Your patience, your compassion, and your decency, and for that I'm extremely grateful. I also want to thank the men and women in county government who have and continue in service, whether it's an emergency response or public health or any one of the county government departments. They have had staff and supervisors have all had to find new ways to serve residents, have had to do it under some very trying circumstances, and we're grateful for them. We're grateful for those who continue to work every day to respond to this crisis, to bring vaccines to those who need them, to provide answers to folks who have questions. And I extend our appreciation to Dutchess County's dedicated staff, to our supervisors and mayors, and those who serve in elected office throughout Dutchess County. We've worked as one. There are times that we could have found ways to not agree. We could have simply put our party politics ahead of anything else. But I can tell you that supervisors, mayors, legislators, town board members, city council members, village trustees all worked and have been working together. And that is a remarkable thing and worth celebrating. And I want to thank the volunteers, folks who have volunteered either service, time, or resource to not-for-profit agencies and to the county government to provide assistance when it's needed the most. I do believe that this community has provided a shining example of really what it means to be good citizens. And these last 12 months have defined who we are and how we expect to live. So for and to all of you, thank you. And now let's get on with a little bit of an update. To jump directly into the data, we're monitoring nearly 1,200 cases, 1,195 active cases. We have seen 35 new cases per 100,000, still in a relatively low risk category, 47 current hospitalizations. We've been hovering at just under 50 these last couple of weeks. Sadly, we did have additional deaths. 415 individuals have succumbed to the virus here in Dutchess County, and our 7-day rolling average is now 4.12%. And we've been just about that 4%, a little bit above, a little bit below. We were just under 4% earlier this week, late last week. We suspect that we're going to hover there. We also want to pay attention to the dashboard. We'll be updating it with some new vaccination data that will be coming available very soon. And you can track some of the success and some of the advancement in vaccine distribution. So let's talk a little bit about that. Dutchess County represents 1.5% of New York State's population. We've talked about this, 1.5% of New York State's population. We have now 18.5% of our residents have received their first dose. The statewide average is 19.8%. We're at 18.5%, a little bit below the statewide average, but we've been making good progress these last weeks. You can see the other counties in the region, Orange at 14.4%. Putnam at 21, Rockland at 19, Sullivan at 14.6, Ulster now at 21, and Westchester at 22. And what we've seen is an increase in the amount of doses being distributed throughout the Mid-Hudson region. So do expect those numbers to fluctuate. Last week we were a little bit higher against the percentage. We expect that next week we'll have jumped a little bit because of a clinic that was set up in partnership with Marist College, Westchester Medical, New York State DOH, and the county's health department. And so at this point, 54,000 Dutchess County residents have received their first dose, and about half of those, 22,000, have completed their entire series of vaccines. And it's interesting, the 54,000 number, I know that we get very frustrated for those who can't yet access the vaccine. Please be patient. I know that's an overused term that nobody wants to hear. But 54,000 residents is a significant chunk of Dutchess County's population already now through their first dose, that nearly 20%, 18.5% already through. So let's talk a little bit. Good. We have some questions, and if you do have some questions, please write them down in the comment section below the live stream. And as I noticed, I didn't say thank you to American Sign Language interpreters. I'm grateful for them too. They've been here every single town hall meeting. They started like in a separate room, and then they were next to us for a little bit. Sometimes they were on separate screens and boxes, but they've been here from the very first town hall meeting we've had. We're grateful to all of them who have participated and helped us out these last 12 months. And I would say this because I think it's worthy of us bragging. We didn't have to be told to have American Sign Language interpreters, and we didn't skip a beat. The very first town hall meeting, we had you here with us, and we're grateful for that, because in this community we do think differently and try to find ways to help those and support those of every ability. Let's talk a little bit about some of the other vaccine numbers. Total allocation for Dutchess County this week, 4,770. Now, most of those are second dose shots, but keep in mind, for every first dose, we have to, 4 weeks later, have to have a second dose. That's going to start compounding very quickly. So we'll be doing tens of thousands of doses in the next couple of weeks, because we're catching up, obviously, with the second doses as well. And just for the record, this week, not only is our health department receiving a shot in the arm with that was a nice pun, with additional doses, but so is Mid-Hudson Regional Hospital. They have received a batch of both Pfizer and Johnson & Johnson doses. The Mid-Hudson region has received a significant amount of Johnson & Johnson doses. Mid-Hudson Regional Hospital has received Pfizer and J&J doses as well. This week, we're administering 2,000 first doses at our health department clinics. That includes Johnson & Johnson doses, as I mentioned. That's a single shot from Johnson & Johnson. We're also hosting a series of pop-up clinics. The first of our pop-up clinics is this week. It's today. It's at John Jay High School in the town of East Fishkill. I saw earlier today there was a post, I think maybe on the East Fishkill Communities page. There was a question about why pop-up clinics are not in Southern Dutchess. Well, they are. The very first pop-up clinic we're having in Mass is at the John Jay High School in the town of East Fishkill. I think there may be some confusion. You were referencing, I think the reader was referencing the pop-up clinics in the village of Millbrook. Those clinics were specific to individuals with developmental disabilities. We were required and requested that we provide vaccines to individuals with developmental disabilities, and it was decided to have most of those clinics central in the county, because agencies were bringing populations, our neighbors with disabilities, to a central location, and that Millbrook site was for that purpose only. We have the clinic today, this Wednesday, at John Jay High School. We're administering several hundred shots there. Great. I was just there with Nick D'Alessandro, the town supervisor. Everything's running beautifully. We're thankful to the Wappinger Central School District and to the John Jay High School administration, along with Nick D'Alessandro in the town of East Fishkill, helping us coordinate that one there. Our next pop-up clinic is going to be at Beacon, I think the Beacon Middle School, the Beacon City School District, the Beacon Middle School, and we're organizing that with the Beacon City School District and Mayor Lee Kiriakou and the staff in the city of Beacon. We're grateful for that. And so there'll be a series of pop-up clinics happening, as I said, John Jay High School today in East Fishkill, followed by Beacon next week. We're also doing one in partnership with Rite Aid in Rhinebeck. So this will be Brookmead in Rhinebeck on March the 15th. And then after Beacon, we intend to be in Pine Plains, Millerton, and Red Hook. And you'll see us again back in Southern Dutchess in the weeks to follow. So managing that, of course, our central clinics are in Southern Dutchess. We have the one in the town of Poughkeepsie. It's just on the Poughkeepsie-Wappinger line, of course, at the J.C. Penney's. We have the one in Dover on Route 22 as well. Now, this week, the state did host a pop-up clinic at Marist College. This was the Johnson & Johnson's shots at Marist College here in the town of Poughkeepsie. 7 days, 3,500 doses over the course of those 7 days. And I know that several were upset, and rightfully so, but we understand why. Once the state provided us access to that link, remember, we don't administer the appointments to the state locations. They do that through the state database, which is it's very easy to access, and by the way, and share. And so when the state announced that clinic, they gave us the link. We sent it out to all of our residents, and it was filled within minutes. In fact, it was about 3 minutes, I think, the state. It was filled before the governor announced it, just so you know. It's actually quite, saddening, but also a bit comical. The governor's office actually tweeted it, and before the tweet, it had already been filled. And so it's just the way that system works. But 3,500 people did get their doses, and 3,500 people are now vaccinated through that clinic. They'll be back again for that in the next couple of weeks. We expect that the state clinics will continue to rotate around the region, coming back to Dutchess. Good question. Are doctors' offices getting doses? Short answer is they're starting to. Several doctors' offices and healthcare networks are receiving doses, small allotments now, but the federal government's announced an expansion and additional purchases of the Johnson & Johnson shots. So we do expect that doctors' offices will receive a larger allotment in the weeks ahead. Now, Dutchess County is partnering with several healthcare providers: Caremount, Premier, and one other. Sean, that's yours. Sun River Healthcare. I apologize. Thank you, Sun River Health. And there's actually another one. We're partnering with them and getting doses to them. In fact, they're assisting us in contacting homebound. So those who are homebound and with significant medical vulnerabilities, we're working with those healthcare providers and have been over this week and next week. And they're providing doses, getting to individuals who either have limited mobility or are strictly homebound. And they're working both from their patient list, who are Dutchess County residents, and our list. And so we're reaching out. And we found actually a lot of homebound seniors who identified as homebound on Dutchess County's vaccine list have already gotten their vaccines or have an appointment for that. So we've made decent progress in those who are identified. Now, if you have not already signed up, please do so at dutchessny.gov. We want you to sign up there. But before we do that, we do want you to know tomorrow, right? I think tomorrow we're launching this, but nevertheless, if you visit dutchessny.gov/gotmyvaccine, very, very creative there, dutchessny.gov/gotmyvaccine, you can sign up to sign off. You can tell us that you are no longer needing to get updates on vaccine information because you've been vaccinated or you're already scheduled to. You'd like to review. I would say only get off our list if you've gotten the vaccine. If you haven't yet and you're scheduled to, please stay on the list only so that you have that opportunity just in case there's a snafu or some problem. But you can sign off of our list, and that'll help us also move through names a lot quicker. Now, obviously, if you've already gotten it, we contact you for an appointment, we're moving on to the next one, but it'll just save some time. So you'll be able to remove yourself from the county's vaccine update list. You won't get those regular contacts from us regarding vaccines if you visit dutchessny.gov/gotmyvaccine. You'll be receiving an email tomorrow that gives you that information. Why do we receive texts and emails when no appointments are available? Well, when we hit send, the appointments are available. And I think it's just hard. It's really hard to appreciate. But for instance, Westchester Medical Center 2 days ago advised us that they had access to 200 doses. We partnered with them. I mean, we want to partner with them, right? We want to have those relationships. So we partnered with them. They asked us to push out a notification. Not they asked. We wanted to make sure that Dutchess County residents had an opportunity to get those 200 doses. The second we got that information, we pushed it out to all of you. But it goes out to 60,000 people. 200 doses will fill in 90 seconds. 200 doses appointments sent out to 60,000 people will fill in 90 seconds. And so if you happen to have gotten that notification, and again, this isn't the way we would do it, but for state scheduled appointments. So these are doses that are available through the state to other providers, not to us. We simply have to give you that contact information and you sign up. So they're not actually filled when we hit send. They're filled once we hit send. And 60,000 people, even getting 2 minutes, 3 minutes later, those appointments can get filled pretty quickly. And so, we apologize, but that is the system the state has laid out for us. But we had 200 slots, and those 200 slots went to Dutchess County residents. We know that because we worked with Westchester Medical to make sure that happened. So we apologize, but that's the way the system is. There's no special sauce to this. And I did see yesterday somebody actually asked me to, that was my foot. I knocked the desk. Making noises. Somebody actually asked yesterday, they said, well, I heard people got phone calls. Different appointments. We are calling people who, through the county's random selection process, we're getting to 2,000 appointments in a week. We're actually calling most people. Most people are getting a phone call from a Dutchess County employee who's getting you in that system. That is different than when we get 200 doses that are made available to us as they were yesterday. And so there you go. Why doesn't Fishkill and East Fishkill have pharmacies with doses? Southern parts of the county have a lot more cases. Well, I'm not the one who decides who has access and who doesn't. Do we have the slide? Do we have a list of which pharmacies have access? The state of New York determines which pharmacies get which doses, and those pharmacies make those decisions. And so all I can offer to you is that the pharmacies that can get doses that have been approved by the state are getting doses. And so they are all over the county. I know that there are those in Wappinger. In fact, I was in a CVS in Wappinger when people were lined up getting their doses. So I do know that they're being distributed. They're not being overwhelmingly distributed in Northern Dutchess. They are distributed throughout these pharmacies. Now, some of the pharmacy chains have decided to centralize distribution. So some of the Rite Aids, instead of in every Rite Aid, they've decided to centralize where they distribute those vaccines. But those are decisions that they make within the state. We've talked about this earlier. If you've not been following along, I apologize, but we said this actually earlier. We were a little hesitant because, we know that pharmacists are good people. They want to help. Pharmacies are businesses, and they're likely to try to give appointments to customers that they already have, which makes sense, right? They're a business. But if there isn't that kind of oversight, then there isn't the ability to more equitably distribute. But I can only tell you that pharmacies all throughout Dutchess County do have some. It is, however, the state's decision as to which pharmacies get which doses. And as I said, some of the pharmacy chains themselves have decided to centralize distribution. But as a Northern Dutchess resident, I can tell you that they're no more easily accessible in Northern Dutchess County than they are in Southern Dutchess, or, by the way, in Ulster. It's just the limited numbers that have been approved. Now, some of what you should know is pharmacies are now going to be receiving direct allotments from the federal government as well. So you should see more pharmacies have more access, and we continue to advocate for doses to be distributed to community pharmacies as well, and hopefully we'll be seeing that as well. So with that, just as a reminder, there's some basic updates that have occurred. Expanded access to vaccines throughout Dutchess. Please, if you're a restaurant worker, taxi driver, public-facing hotel employee, or work in food pantries, staff and volunteers, if you're working with employees to coordinate, as we do with essential employees, you all qualify, and you should sign up. And we want you signed up for vaccine. We want you signed up. If you're an employer, and you want information on getting on the list. So this is for essential workers, right? So for essential work staff, we try to reach out to these employment bases because the state gives us doses that are supposed to be dedicated to essential workers, some that are dedicated to those with disabilities. Other doses are dedicated to those with underlying health conditions. We have a lot more latitude now, but we want to be sure that those who are identified as essential workers, approved restaurant workers, taxi drivers, public-facing hotel employees, food pantry staff and volunteers, other employees that coordinate or work with essential workers, schools, public police officers, firefighters, etc. If you're we want to make sure you're signed up. So get to the vaccine list. Make sure you're signed up at duchessny.gov on our vaccine information form, vaccine info form at duchessny.gov/vaccine info form. If you're an employer, though, so you're a grocery store and you have staff that are employed within that grocery store that qualify, or you manage a taxi company or a hotel, and you want to get signed up, please email us. Email vaccineappointments@duchessny.gov. If you are an employer of those individuals who identified by the state are essential employees, you can email us at vaccineappointments@duchessny.gov. Vaccineappointments@duchessny.gov, and that's how you can get more information about getting on the essential worker list so that we can move through those essential workers as well. So the state's updated eligibility. Anyone, beginning this week, anyone 60 years of age and older now qualify to be vaccinated in the state of New York. If you're 60 years of age or older, you now qualify to be vaccinated in the state of New York, and beginning on the 17th of March, the state has expanded its essential worker list to include public-facing government and public employees. So if you work in the government office and you're dealing with the public in an open way, right? So this isn't scheduled appointments in the office, but rather just as a reference, the town clerk, right? Meeting with people at the town hall, DMV clerks. I think we've already gone through some DMV clerks as well. But public-facing public and government employees now qualify as essential workers. Nonprofit workers who provide public-facing services. So you're out in the community as a not-for-profit staff member, you now qualify. And then essential workers, in-person, public-facing, building services workers. So essential in-person, public-facing, building services workers. Did you get that one? Essential in-person, public-facing, building service workers also qualify. And yes, I was asked, library workers, you all qualify. You're public-facing, you're in the library, so we want to make sure that you get your vaccines as well. Other good news, all providers except pharmacies can vaccinate anybody. So whoever has a dose, whoever has doses except for pharmacies can vaccinate anyone who qualifies within the state of New York. Pharmacies, however, are to focus on two categories only, 60 years of age and older, and teachers, and that's per the federal guidance. So pharmacies are only permitted to give vaccines to individuals who are 60 years of age or older, beginning on March 17th, and school teachers. That is it. Everyone else who provides vaccines, including the health department, can provide to any of those categories of people that have now been approved. So next week we'll have a greater amount of flexibility, and we're going to move through those lists pretty quickly. Do want you to remember that the state of New York runs clinics as well. And of course, I do want to advise you that if you visit our website at duchessny.gov and you take a look at the state link, this Am I Eligible link, you'll be able to sign up for a state appointment. There are now available appointments at Westchester Medical in Valhalla, right? Westchester Medical Center in Westchester County, and SUNY Albany do both have a significant increase volume of appointments, and I encourage you to take a look at those locations regularly. Any given day, there are more appointments made available at those locations. We also expect 2 new regional vaccine sites, one in Orange County and one in Ulster County. Those will provide greater proximity to us. We do expect that there will be more in counties across the state, but if you looked at the data, you could see the western side of the Hudson River still struggling to get some of its numbers up as far as doses. They're not the fault of anyone, just to try to get those numbers up. And so 2 new regional sites will be opening soon. Will Marist continue to get doses? Well, the short answer is yes, but not regularly. So it's sort of the state has dubbed them a bit of a traveling circus. These are the state-run pop-up clinics that came in for 7 days, and then they're taking that clinic to another location, running that someplace else for 7 days. They'll be back, and we do expect that they'll be back in Dutchess County within the next several weeks, and at Marist College yet again. I want to remind you, pharmacies, many pharmacies do have access. Just as a reference, Walgreens in Freedom Plains, access this week. Walgreens in Wappingers, access this week. Rite Aid in Poughkeepsie, access this week. Additionally, Pleasant Valley Chemists, the Neighbor X Pharmacy, that's cute, Neighbor RX Pharmacy, in Pleasant Valley, McCarthy's Pharmacy in Stanfordville, Millbrook Pharmacy in Millbrook, Benzer Pharmacy in Amenia, Pine Plains Pharmacy in Pine Plains, and then other locations are receiving direct doses. CVS Price Chopper and Market 32, Tops Market, and Stop and Shop all have doses and are administering vaccines again this week. As we mentioned, Mid-Hudson Regional received 1,300 doses, and they're working with us, as I said, to get those out throughout Dutchess County. Schools going back full-time is a question. Schools can go back. There is no prohibition, and I do want to be clear about this. There is no prohibition on students returning to the classroom in the state of New York. There are certain limitations and mitigations that have to be taken into effect. There has to be, when possible, some physical distancing. So there does limit the capacity to some degree, but it is not a mandatory 6x6. It's also not a mandatory 3x6. What the CDC has advised is that when we believe there's a low to moderate risk in a school, and the state of New York has basically said statewide there is low to moderate risk. So counties across the state have been advising school districts that you do not need a firm or rigid adherence to that physical distancing. So where it can be sustained, then you should do that. If you can maintain that in a classroom, great. If you can't, then you don't have to. If you can maintain it on a school bus, great. If you can't, then you don't have to. And so it gives school districts a greater degree of latitude, but that is the basic guidance. If you can mitigate transmission by wearing masks, by monitoring personal health, and by engaging in some of the distancing where possible. For instance, you wouldn't necessarily open up the cafeteria, and you wouldn't have kids, jammed into an auditorium. But if you can maintain, and by the way, scheduling would have to be limited, right? So you're not throughout the hallways packed, but in a rigid setting, in a structured setting like a classroom, and even in a structured setting like a school bus, if you can maintain certain other mitigations, students go back to school. I know my school, Red Hook School District, has been surveying parents, asking if kids, families are comfortable and what concerns they might have. I will tell you, my family is comfortable with it. My children, and I have many of them, 4 of them, 2 in public school right now, going back to in-person education. We've seen the data. Dr. Wythian's been here many times talking about limited risk in a school setting. So if there is the ability to maintain those other mitigations, provides for certain protections, then schools are able to have students return. And so we will see that occurring. Districts are making those decisions now. Now, do volunteers count under the not-for-profit eligible? So if you are a volunteer or staff for a not-for-profit that provides a public-facing service, so you're not necessarily volunteering in the office, but you're out at a food pantry, although those already qualify, but you're out in the community interacting with the public, yes, you qualify. You should have some proof of ID, some identification. It could be a letter from the employer, right? I work for Dutchess Outreach, or yes, Miss Mark Molinaro does in fact work for Family Services. I don't, but if you have something of that nature, fine. If you have an identification or a business card that confirms it, fine. Most of this is we're trusting you. But you may be asked to have some sort of identification, and so you should have something that proves that you work there. It could be even a pay stub that says that you work there, or if you're a volunteer, you might have a letter or note or some confirmation from the organization, even if it's a roster that says, here, this is one of our volunteers. All of that perfectly fine and enough for us for anyone to administer the vaccine. Do want to mention again. I am required, but I also enjoy giving and delivering the State of the County address. This is the annual presentation to both the county legislature and public at large. Talk a little bit about what we've experienced these last 12 months and looking forward to initiatives in the future. I would ordinarily deliver that at the Culinary Institute of America with 600 of my closest friends. And believe me, as my wife would tell you in a heartbeat, I don't mind being in a room of people who clap when I'm done talking. But this year is not the year we're going to do it. So even though we were able, interestingly enough, to deliver the State of the County address in person last year, we're not doing it this year. This year it'll be virtual. And so next Tuesday, March 16th, on a number of platforms, if you want, it'll be 16 or 20 minutes of your life that we'll take from you, but we'll be releasing the State of the County address on Facebook and YouTube and it'll be available for viewing. So I hope that you can join us for those few moments, and you'll hopefully hear some information that'll be interesting to you. But other than that, we'll be back together, hopefully in a room someday in the near future. And so, also big news in the town of East Fishkill was just, again, as I said there, just moments ago, with the developers of the West Campus, the IBM West Campus. This has been vacant for 30 years, built up and vacant for 30 years. And there have been attempts to get this particular property redeveloped in partnership with the town of East Fishkill, and we're very grateful to the leadership of Nick D'Alessandro, the town supervisor, and the town of East Fishkill town board for they just have run a great operation. The IBM West Campus, thanks to Blue Water Property Group in the town of East Fishkill, is being transformed into an Amazon facility. So this is not a distribution center. This is a fulfillment. No, this is not a fulfillment center. This is a distribution center. It's one or the other. I always forget. So this is actually a location where vendors who do business with Amazon send their products to. This is not where you or I might get an Amazon delivery, right? This is where the products go, and from this location, they then get distributed to other locations to ultimately get to homes for distribution. So 500 new jobs. I think the average salary, $62,000, $60,000, about that end. So starting, certainly entry level, right on up to some administrative positions and supervisory posts. And just the ability to transform that particular property, which has been vacant for so long, it fits right in that technology park that's been developed. So the iPark investment on the east side, throughout the campus, along with On Semiconductors, formerly Global Foundries, formerly IBM, making major investments there. Imagine Technology Group making significant investments there, and then of course other businesses like Sloop Brewing Company. If you haven't had a juice bomb and you like a beer from time to time, they're good. They are good, Sean. Not allowed to say that. Also, I'm thinking of the what is it called? Crepini from Brooklyn moved here. So a lot of businesses taking up stake there, and we're just grateful to see that property transformed. Please. Yes, let's do that. Let's do both of those things. Thank you very much. If you have a question, write it in the comment section below the live stream. We're going to wrap up in just a few moments. When we send you an appointment link, just do remember that if you're sharing that with gobs of other people, that means people who were scheduled to get access to those appointments wouldn't get access to those appointments. So for instance, if you're an essential worker and we're giving you the link to sign up and you share that with 3 of your friends, those are 3 friends who are taking that slot from some other identified essential worker who's planning that appointment. So please, as much as I'd like the system to work better than it does, that link that the state provides for you to sign up cannot be shared, should not be shared with others, although I acknowledge that it's a bit of a sloppy system, but we're hopeful that you would honor that, and do want to remind you that over the course of the next several weeks, now that doses are and access is expanding, you'll have and see us with pop-up clinics. So as I said, today we were at John Jay High School. In fact, we're still at John Jay High School in the town of East Fishkill, where we're conducting a clinic. Really great job. Thanks to Supervisor D'Alessandro in the town of East Fishkill, Wappinger Central School District, and the staff at John Jay, and all of our Medical Reserve Corps volunteers and the staff at the Department of Behavioral and Community Health. So we're there today. Next Wednesday, we'll be at Beacon Middle School, and then from there, expect us in Millerton, Pine Plains, Red Hook, Rhinebeck, and right back around. We'll be back down to Southern Dutchess and making the loop, if you will. Very grateful to the Department of Behavioral and Community Health staff who've been working with our Department of Emergency Response. We've actually created pop-up trailers. So basically, this is the pop-up in all of the equipment, all of the supplies necessary to administer these pop-ups are in our emergency response trailers, and we trailer them in. We set up, again, a little bit like a traveling circus, set up, put up the tents, put up the tables, chairs, set down the cones, and staff comes in, works the clinic, and then we break it back down and travel off to the next location. So a really good operation. If you've been at one of our vaccine sites, I think you'd be very impressed with the staff and the volunteers doing great job. What counts as proof of more comorbidity? Do medical records work? Well, a medical record works, but I'd suggest that you don't give us that. First, we're supposed to keep the information, so we'd want a copy of it, and we don't need to know which comorbidity you have. In fact, HIPAA protects you from having to tell us that. So if you go to our website, duchessny.gov, you'll see this form, the COVID vaccine eligibility attestation form. Attestation form. You can have a doctor or pharmacist fill this out, or duchessny.gov/eligibility form, duchessny.gov/eligibility form. Just a note from your doctor that says, yes, indeed, this individual has one of the identified comorbidities. That's sufficient. We don't want to know which comorbidity you have, and you shouldn't want to have to tell us, so we don't want anyone feeling they must. If you have your medical record, you want to give us a copy of it, you're welcome to do that, but we are keeping the form on file because technically we can be audited by the state. I'm not sure that they have the time to do that, but we can be audited by the state. We just have to prove that we did, in fact, screen everyone who came through. And so a doctor's note confirming you have a comorbidity, a pharmacist signing off on that. Some pharmacists don't want to do that, but I would encourage you, just if you know your pharmacist, all they're attesting to is that basically the medication they're distributing to you is for one of these identified comorbidities. That's all they need to be able to confirm. They're not confirming, in fact, that you have it. Just that the medicine they're giving you is the medicine that's been prescribed to address one of those comorbidities. And if they're willing to sign that, that's sufficient as well. So please, again, visit us at duchessny.gov. If you have any additional questions, write them in that comment section below the live feed. Otherwise, we're going to wrap up in just a brief moment. Again, most of the data points pointing in the right direction, very good, positive. Please be safe these next few weeks. We are seeing some uptick in some places, so do take these basic mitigation steps, the things we've talked about all along. Wear your mask, keep a little bit of a distance if you can, and wash your hands and monitor your own personal health. If you're not feeling well, don't head off to work or school. And obviously continue to be safe. If you're going off to vacations, I know there's some spring break coming up or going on now. Please be safe about that. There are, if you're vaccinated, no travel restrictions. Remember, the state still does require, if you're not vaccinated, come back and quarantine for a short period of time and then be tested. But if you are traveling, just be very sensitive to being around others. Obviously, we're not ignorant of the fact that people just want to get out. But we do want you to be smart and be safe about it. So if you are in big groups and you choose to do that and you come back home, I think you're best to kind of stay home for a little bit. Make sure that you don't have any symptoms. Maybe be tested if you can get access to a test, which there's greater access to, and be smart about that. But if you can avoid crowds and you can avoid sort of those big gatherings while you're out and about, if you're traveling, please try to do that. And we're almost there. We are almost there. Thank you. Thank you for your comments. Somebody commented that they went to the John Jay High School clinic today and was efficient and well run. I have to tell you, thousands of people have come through our clinics. I wish hundreds of thousands have come through the county clinics because, frankly, they are run perfectly. Honestly, they are smooth. It's a smooth operation. Everyone is so genuinely nice. We have volunteers. We have staff. And when you are there, if you are getting your vaccine with us, one, I don't have to tell you. I think you'll probably be happy to be there anyway. But say thank you to one of those folks wearing any number of those vests, red, yellow, blue. They're the hard workers. I mean, we try to celebrate them, and I think we've all worked pretty hard, but these folks have been at it every day for the last few weeks. I mean, 10, 12 hours a day, setting up, organizing the clinics, managing the clinic throughout the day, and then, of course, taking it down and getting started all over again. Some of these folks are the ones that are, they're at the fixed clinics at JCPenney's and Dover, and then they're getting in their cars and helping us at our pop-up clinics as well. So do say thank you to them, but we appreciate the kind words, and I'll extend your appreciation to them as well. Do I still need to get tested if vaccine completed for weddings? No, you don't. If you're vaccinated, you're vaccinated. Anyone who's attending an event needs to confirm that of that nature, right? If there's a testing requirement, we want you to be tested. But if you are vaccinated, you probably should prove it. But you should be perfectly fine. If you visit duchessny.gov on the website, right, if you're an event venue or you're organizing a wedding, there is a form that we ask you. It's an online form, very simple. Fill it out, offer up the information. You'll see it there and go on with your business. But between weddings, The state also has advised recreation, cultural, arts activities, events can all start opening up again. So social gatherings increase from 50 to 100 for indoor, 200 outdoors. So average community gatherings now, 200 people outdoors, recreation events, cultural events, 200 people outdoors, 100 indoors. At your home, and I don't know why you'd want 25 people at your house, but 25 people, up to 25 people outdoors is the expected limitations. 10 people indoors. I mean, that's just my family. And then, of course, as you can see, arts events, entertainment venues, 33% capacity, and up to 200 people outdoors. You can see that. If you're testing, in other words, if you're having an entertainment event or a cultural event and you're testing people, you can be up to 500 people outdoors. So if they come and confirm testing, well, 500 people. And so there you go. A little bit of advancement there, and we're happy about that as well. Any other questions? We'd try to get to them. Otherwise, we are again live with you next Wednesday at 3 p.m., March 17th at 3 p.m. That is one day after the State of the County address. If you're available to watch that, it'll be on the 16th. And our next telephone town hall and Facebook Live town hall is Wednesday, March 24th at 5:30 p.m. I cannot thank you enough for these last 12 months. You have been patient, and believe me, I read a lot. The other day, some woman commented on a Facebook post, and then I responded, and she yelled at me for responding because I was responding apparently on her dime. I am on your dime every day. We all work for you 24 hours a day, 7 days a week. The staff here knows. I think it was about a week ago I was sending out emails and responding to Facebook posts with appointment information, vaccine information at 2 in the morning because I couldn't sleep. But not asking for sympathy. We just want to try to get you information when we can, how we can, anytime we can. But we read it all. And my point is that we have certainly there have been times where we've been at each other. As a community, we've disagreed, we've been upset about things, we've seen political upheaval, we've seen civil unrest, we've had to certainly respond to this pandemic, and there are people who've been out of work, there are people, businesses have been shuttered, there are families that will never see their loved ones again, but through it all, no matter how heartbreaking the loss, no matter how tragic the challenge has been, through it all, I believe that you have been wonderfully patient. You have been respectful overall to the work that we do, and even in those moments where we think that maybe others could be a little bit kinder, a little bit more compassionate, I know that you've summoned it, and for that we're very, very grateful. And so with that, I'd like to thank you for joining us on our 60th Town Hall Forum. We'll be back again next week, and if you need information, reach out to us in the meantime on Facebook or directly to us. We'll try to be of assistance, and in the meantime, stay safe, be healthy, and be kind to each other.